Okay, so in this section we're going to be talking about the spinal nerves. So right here in this view, you guys have a cross section of a vertebrae, and what you guys can see here is actually the formation of a spinal nerve. So in order for a spinal nerve to form, you have the dorsal root and the ventral root coming out of the spinal cord, and when these two unite, their junction is what actually creates the spinal nerve. So as you can see right here, we have all the spinal nerves. You can actually see them coming out on both sides of the spine in this diagram here, and the name of the nerve is actually going to be dictated by depending on where the nerve is actually exiting from in the spinal cord. So for all the nerves that exit through the cervical spine, you would call those cervical nerves. The nerves going from T1 to T12, so exiting from the thoracic spine, you would call those the thoracic nerves. You have L1 through L5 for your lumbar nerves, and you have your sacral spine is going to be your sacral nerves, and at the very end you're going to have your coccygeal nerve as well, which is going to make a total of 31 pairs of nerves altogether for the spinal nerve section. Right over in this section, you guys can actually see two of the other structures that I want to talk to you guys about, and that's going to be the dorsal ramus and the ventral ramus. So the biggest difference between the dorsal root and the dorsal ramus and the ventral root and ventral ramus is that it's just the points of connection that they have. So for when you're looking at the dorsal root, you're looking at the connection in between the spinal nerve and the posterior horn of the gray matter. And when looking at the ventral ramus, you're looking at, the ventral root, you're looking at the connection in between the anterior horn of the gray matter to the spinal nerve itself. So when you have the dorsal and the ventral root meet and connect to form the spinal nerve, once that spinal nerve is split, when it goes back into the body, is when you have your dorsal ramus form and you have your ventral ramus form as well. In this case here, what I want to show you guys is that the dorsal and ventral rami are the connection from the spinal cord to basically all of the rest of the body and all the rest of the body organs below the neck. Unlike the nerves in the central nervous system, the nerves in the peripheral nervous system are mixed nerves, which means that they can both carry information from the body and from the sensory receptors to the brain, and they can actually also carry information from the brain to the muscles and to the effector sites. Peripheral nerves basically supply all of the somatic regions below the neck of the body. So as you guys can see here, every spinal nerve splits into two different rami. So like as we spoke before, this being the dorsal rami and these being the ventral rami. So let's talk about the posterior or the dorsal ramus first. The posterior or dorsal ramus is the thin one out of the two, and it basically just innervates the muscles on the posterior part of the neck and the back musculature. And the ventral ramus or anterior ramus is the one that innervates the intercostal and muscles and the nerve plexuses. So it basically is the pathway to innervation for the rest of the body organs that are and rest of the body muscles that are excluded from the posterior neck muscles and the back musculature as well. So the four major plexuses of the spinal cord that we're going to be discussing today are the cervical plexus, the brachial plexus, the lumbar plexus, and the sacral plexus. Starting with the cervical plexus, we're going to go by and talk about the main nerves and the most important nerves out of each one of these plexuses in the body. So starting with the cervical plexus, we're going to go with the phrenic nerve. The phrenic nerve is mainly responsible for the contraction and relaxation of the diaphragm muscle. When the nervous system stimulates the diaphragm through the cervical plexus, the diaphragm contracts, causing the respiratory cavities to expand, making it easier to inhale. And once the diaphragm is relaxed, the respiratory cavities go back to their regular size, making it easier for the body to exhale. Also, the cervical plexus happens to run from the vertebrae C1 to C5. Next up, we have the brachial plexus, and with the brachial plexus, we'll be talking about the musculocutaneous nerve, the median nerve, the ulnar nerve, the axillary nerve, and the radial nerve. The musculocutaneous nerve is a nerve that mainly innervates and affects all of the areas and anterior regions of the arm. The median nerve is also in the brachial plexus, and this also innervates most of the interior muscles of the forearm, being an anterior nerve as well. The ulnar nerve of the brachial plexus actually innervates the half of the hand and lower part of the forearm, mainly the side where the pinky and these two fingers are. Everything covering here and mostly throughout this part of the forearm is going to be innervated by the ulnar nerve. Now, the axillary nerve is actually a posterior nerve, and the axillary nerve is going to be innervating the entire posterior aspect of the arm, so back of the arm and back of the forearm as well. And last, in the brachial plexus, we have the radial nerve, which actually innervates the shoulder muscle, which is called the deltoid, and also the teres minor, which is a muscle in the back, located right around the shoulder blades in between the scapula and the cervical spine. Moving on to the lumbar plexus, now we're talking about the femoral nerve, and the femoral nerve happens to come out under the inguinal ligament. It supplies all of the muscles in the anterior compartment of the thigh. It supplies the femoral joint and also the skin in that area of the leg as well. And in the lumbar plexus, you also have your obturator nerve. Your obturator nerve is the one that passes through the obturator foramen, and it innervates the medial aspect of the thigh. So medial aspect of the thigh being the inside of the thigh, this area right here. And last but not least, in the sacral plexus, we have the sciatic nerve. So the sciatic nerve is actually a nerve that passes through the sciatic notch of the hip bone, and it slips into the, it actually splits into two different nerves called the tibial nerve and the fibular nerve, the common fibular nerve. And this split happens of the nerve just above the popliteal region of the knee, which is the posterior aspect of the knee. So right above the knee joint, the sciatic nerve splits into the tibial nerve and the common fibular nerve in order to innervate the muscles of the lower leg and foot.